The word epidemic gets used a lot these days, but it may be the case that that word is not strong enough to describe this country's recent surge in opioid.
Coffee, Doctor?
Oh, fine. Have a Camel with your coffee. Thanks. You know, this night work's kind of rough, isn't it? That's right. But a Camel's always a pleasure.
Yes, folks, the pleasing mildness of a Camel is just as enjoyable to a doctor as it is to you or me.
Hey there, internet television viewer. Are you sick of perpetually negative news stories? Me too. Stick around. Positive news story that is long overdue. What's up, internet? What's up, YouTube? You've tuned in to internet television, and as always, I am your host, Mr. X. We have a lot to dissect, so let's just begin. I'd like to preface today's episode saying I don't find addiction funny, nor do I find drug abuse funny, but this is internet television after all, so. Two former executives of the Rochester Drug Cooperative, or RDC for short, are being formally charged with unlawfully distributing oxycodone and fentanyl, in addition to conspiracy to defraud the Drug Enforcement Administration. The two scumbag drug lords are former CEO Laurence Doud III and William Pierzewski, a former compliance officer. Federal prosecution asserts that between 2012 and 2017, the RDC, a sort of middleman in the distribution of medical-grade drugs, saw an increase of 800% demand for oxycodone and a 2,000% increase in demand for the ridiculously addictive fentanyl. Further, of the 1.5 million orders of the high-powered narcotics between 2012 and 2016, the now infamous company flagged only 4 as suspicious. Some of the flagging criteria are: customers pay in cash, customers who travel long distances to pick up their narcotics, unusually high volume of narcotics at the pharmacy level. In an epic win for the American people, Laurence Doud was arrested on 1 count of conspiracy to distribute controlled substances and 1 count of conspiracy to defraud the United States. He faces 10 years to life in prison. What would a good old-fashioned conspiracy story be without a statement from the criminal defense team? Dowd's attorney states they will fight the charges in a statement. Mr. Doud is being framed in no uncertain terms. The government has it all wrong and is being used by others to cover up their wrongdoing, said his attorney Robert Gottlieb. Mr. Doud will fight these false charges to his last breath, and he will be vindicated. Bullshit! Former compliance officer of the RDC was also arrested for the same charges, but the defense team failed to comment. The suspicious drug cooperative entered a deferred prosecution agreement, which will expunge all charges in lieu of a $20 million fine, in addition to reforming its controlled substances compliance program, and subjects itself to being supervised by independent monitors. The most disturbing part is internal emails uncovered during civil investigation showed company employees attempting to notify management about the possible shenanigans and ultimately malpractice. One particular employee said, "Like a stick of dynamite waiting for the DEA to light the fuse." Dynamite! America is being poisoned while executives like these make gargantuan profits year over year. The opioid business is a mechanism of grief and suffering. Companies like RDC peddle mind-altering substances under the guise of, quote, health or, quote, well-being. RDCs and companies like this contribute to the masses of suffering all across the nation. Millions, if not billions, are made at the expense of families, working people. People, if they had another way, would be better. People without their poison. The penalty imposed on the party involved are laughable at best. While the long arm of the law has placed a spotlight on the unlawful aspects of the RDC, the fine imposed is simply not enough. The CDC reports that 70,237 deaths occurred in 2017 alone. This is sadly $284.75 per casualty for 2017. I'd love to tell you the RDC's net worth, but that information is auspiciously hard to find on the internet right now. I have a unique disdain for the pharmaceutical industry. For years and years, I've tried to warn people of the ills of the companies that trade ecstasy for death. Decades of conditional marketing from these very sly organizations insist humans are depressed or have severe anxiety or children have ADD. And as such, the typical solution: meds from our friends.
He's the one that called that the feels good. He's the one that makes you feel alright. He's the one that called that the feels good.
The truth is, we've all known at least one person that hasn't either been directly impacted by the pervasiveness of high-powered, legal opiates, or indirectly by other relationships and connections. Ultimately, the question is America sick? Are the benefits of companies selling and peddling the cure outweighing the risks of the population? For decades, we've been told we're sick, sad, happy, sleepy, angry, lonely, anxious, depressed, overactive, inactive, etc.
And the government always says drugs are illegal because they're bad for you. We're trying to protect society. The government don't give a fuck about your safety. Shit. Nah, the government's like this. The government, they don't want you to use your drugs. They want you to use their drugs. So every night on TV, you see a weird-ass drug commercial trying to get you hooked on some legal shit. And they just keep naming symptoms till they get one that you fucking got, okay? It's like, are you sad? Are you lonely? You got athlete's foot? Are you hot? Are you cold? What you got? You want this pill, huh, motherfucker? You got to take this pill.
The CDC concludes after examining several cross-categories of synthetic pharmaceuticals such as opiates and antidepressants and cross-section of age groups. The figures above are bar charts showing the number or rate of U.S. overdose deaths involving select prescription or illicit drugs from 1999 through 2017. The bars are overlaid by lines representing gender and opioid involvement. There were 70,237 drug overdose deaths that occurred in the United States in 2017, with 66% cases among males. The main driver of drug overdose deaths were opioids, mainly synthetic opioids. With a 12.9-fold increase from 2007 to 2017. This story needs to change. I perhaps foolishly believe we, collectively, can understand lives are almost assuredly better away from continual pharmaceutical intervention. There's a lot of darkness surrounding those afflicted with a continual addiction, but I believe it's one we can overcome. Everyone needs time to heal. I would like to thank you if you stayed to the end. This has been Internet TV. I have been your host. If you liked this episode, wang chung that like button. If you'd like to see more, please consider adding Internet TV as a sub. Lastly, but more importantly, please share if you think justice is sorely lacking in the story. this is all the time we have for today. See you in the next episode. Till then, don't get arrested.